Namaste. Have you ever felt like somebody said that you have ADHD and you're some big failure? You got some big problem. You need to get it checked. You need to get it fixed. Well, I'm a board certified practicing family doctor, and you can see in the picture on the left where I had a disorder, I had a problem. And then you can look on the right where I've inspired from these perceived problems. ADHD. How dare somebody says that you have a disorder? It could be something that you have not inspired from yet. If you find yourself waking up in the morning, trying to get a bunch of things done, not getting anything done, and people saying that you're a problem, you shouldn't be talking to them. I want you to feel better about yourself through evidence-based writing techniques called Mind Hygiene. And when I talk to my patients about these evidence-based techniques, it really hits home with them. And these are techniques where you don't need a doctor, you don't need a therapist, you don't need medications, and you don't need a bunch of fancy gadgets to help you. You just need yourself. Let's take an example. There was a patient that I saw earlier today who was talking about how they have such problems at work through their sales job, and then when they come back home, but all of a sudden they can play video games. So here's the thing about this, is that the limitation is that I have a disorder, I have a problem, everybody else says that I have a problem, and I need a medication now. Now, I'm a medical doctor, I prescribe, but there are other things that will work for you. Let's take an example. This is what I do all the time when I come into work. Let's take a look at this. This is February 13th, 2025. What am I writing here? Now I'm writing about my emotions, positive, negative emotions. I don't like to use those words, but I was reading a book called Think and Grow Rich. And here when it comes to the positive emotions, desire. What is my desire? My mission, vision, purpose. My mission is to help others. My vision is to donate, is to make money, to help other people with the money that I make because I have everything that I need. I've been blessed. And the purpose is that my mom died from schizophrenia and COVID. My brother died from alcohol and drug use. I myself, I've been sober for 7 years. So some of those things, God, faith, love, all are things that will drive me, enthusiasm. And here are some negative emotions that I no longer display, which is anger, fear, jealousy, hatred, revenge, greed, or superstition. And here's the thing about some of these things is that if you don't write it, you don't know it. But you can't just write it one time. Look at all of these writings. And this is what happens every day when I come into work. Here's January 21st. I flip it around. What am I writing here? Mind hygiene. It helps me feel good about 80% of the day. I feel pretty good with that. Right now, I'm not eating sugar. I'm staying sober. I got good meditation techniques, at least, for my own sake, like for my own wellness and my health. I feel that my meditation is good. Sure, I'm a little lonely because I live alone. But at the same time, I have all of these things. Even though I feel bad I'm alone, rejection, it happens 100,000 times. But all you have to do, like Mark Cuban says, is to get lucky once. And here are some other mind hygiene techniques. Here's another MVP that I've written, and here's some other things that I was writing on the back. And you can see how I just keep writing. So here's the thing, is that these writing techniques are not gonna help you like right away. You're not gonna be able to go to the gym and put on muscle or lose 30 pounds right away. It could take a year, year and a half. If you were to sit down with yourself every 90 minutes and take 1 second to write, let me accept that I have this perceived problem and what can I do about it? Maybe what I can do is separate everybody who says that I have a problem and who is trying to display their self-limiting beliefs on me. You have a disorder, you need a medication. I had a disorder, I need a medication. What am I doing here? I'm displaying my own beliefs. Look, I'm not taking any meds to manage ADHD because the stimulants can stimulate the heart. They can lead to heart attacks and strokes. So what am I going to do instead? I'm going to use mindfulness-based cognitive techniques that have medical evidence to support them, and I'm going to do them all the gosh darn time. 1 to 90 seconds every 90 minutes. Let me accept, embrace, instead of fix and control, and feel better about myself. You can subscribe, hit the notification bell, write some things in the comments, ask me questions to see what you would like to hear again. In review, if you feel like ADHD is a failure, you can look at the before and after pictures. The before picture was of me on substances. Substances include me not eating well, sugar, alcohol, nicotine, bad people around me, complaining, blaming. Those are all bad substances. Now what I've done is I've accepted and embraced what I feel I don't like about myself, talk to the people who are growing, write for 1 to 90 seconds every 90 minutes, evidence-based mindfulness-based cognitive technique called Mind Hygiene, and feel better about myself. Namaste.